Top 3 minerals that instantly flush out toxins and lower creatinine naturally. Waking up worried about rising creatinine can feel terrifying, especially when your kidneys are already at stage 3 or above. When toxins stay longer in your bloodstream, your body sends early alarms like swelling, nausea, or metallic taste. That is the danger of slow filtration. Today we break down 3 powerful minerals that help your kidneys push waste out more efficiently and naturally lower creatinine. Do not miss the second item because most people overlook it even though it works quickly. There is also a bonus tip waiting for you at the end. We begin with a mineral that directly influences how fluid moves through your tissues and how well your cells manage waste. It supports healthy circulation inside the kidneys and can make filtration smoother. Our first mineral to explore is magnesium. Magnesium plays a very important role when someone is dealing with high creatinine because this mineral helps the kidneys work with less strain, improving renal blood flow and helping lower creatinine naturally. When magnesium levels are steady, the small blood vessels inside the kidneys widen more easily, a process known as renal vasodilation, and that simple widening improves the speed at which toxins move out of the bloodstream. This response matters even more when someone is at stage 3 or above, because the kidneys often struggle to maintain steady flow on their own. Magnesium also loosens the smooth muscles that surround those tiny renal vessels, and that relaxation lets the kidneys push fluid more evenly, which can lower internal pressure and encourage waste release. Many people do not realize how magnesium supports electrolyte balance either, and this balance affects how well the kidneys hold on to useful minerals while letting go of harmful compounds like creatinine. If electrolytes shift too far in one direction, the filtering process slows down, and that delay increases toxin concentration. Studies from a well-known United States research institute have shown that magnesium deficiency increases renal stress by forcing the kidneys to work harder to stabilize sodium and potassium movement. This becomes even more important for anyone who has chronic kidney problems because the sodium-potassium pump in the body helps regulate how cells move water and waste. When magnesium supports this pump, the kidneys stay more stable and filtration remains smoother. Moving deeper into this topic, it helps to understand where people can get magnesium through common foods, rather than supplements because foods tend to offer a safer and more balanced form. Leafy greens are among the best sources, and spinach can supply around 79 milligrams of magnesium per cooked cup. Swiss chard also carries a similar amount when cooked, and both contain additional plant compounds that support antioxidant activity. These greens help reduce inflammation inside the kidneys when eaten in reasonable amounts and at the right time of day. Another strong source is pumpkin seeds, which offer about 150 milligrams of magnesium per ounce. Pumpkin seeds work well for many people, but flavored versions often contain extra sodium or spices that irritate the urinary tract. So plain unsalted seeds are the better choice. Almonds are another reliable option and carry about 75 milligrams of magnesium per ounce. Although people who have a history of kidney stones might need to control almond portions because almonds contain oxalates that can influence stone formation. Black beans are a gentle and affordable source too, providing roughly 60 milligrams of magnesium in a half-cup serving. They support stable energy and better digestion, although seniors may notice more gas if they are not used to beans. Soaking beans before cooking reduces this problem and also helps mineral absorption. There is also the question of how much magnesium is safe for someone with stage 3 or above kidney disease. The safest approach is to focus on food-based sources rather than supplements because food releases magnesium slowly and gently. Most adults can safely consume around 200 to 300 milligrams of magnesium from food each day, but people with serious kidney impairment should stay within a personalized range advised by their healthcare professional. The best timing tends to be midday or early afternoon when digestion and circulation are more active. Eating magnesium-rich foods late in the evening is not helpful because the kidneys slow down slightly at night and cannot move toxins as efficiently. Certain foods weaken magnesium absorption, for example, high phosphate. Processed meats, because phosphate burdens the kidneys and competes with mineral balance. Foods rich in vitamin B6, like bananas or potatoes, support magnesium absorption and can be paired in small portions. Do you usually eat your main meal early or later in the day? And have you noticed whether certain foods make you feel more bloated or fatigued afterward? This information can help identify where magnesium intake fits best in your routine. When choosing magnesium-rich foods, freshness and quality make a difference. Greens should look vibrant with no yellow edges or slimy patches. Almonds and pumpkin seeds should be dry, firm, and sold without added oils, sugars, or flavor coatings. Many packaged nut products contain hidden sodium or sweeteners that strain the kidneys, so reading the label is essential. Plain raw or dry roasted versions are the safest picks. Beans should be stored in sealed containers in a cool pantry, and cooked beans should be kept in refrigerated glass containers to prevent moisture buildup. Loose pumpkin seeds stay fresh longer when stored in an airtight jar away from heat and light. A simple meal idea that works well for midday is a magnesium-rich salad. It can include a cup of cooked spinach cooled slightly, a tablespoon of plain pumpkin seeds, a small sprinkle of chopped cucumbers, and a teaspoon of olive oil. This combination offers minerals, hydration, and fiber without overwhelming the kidneys. Another easy option is a warm bean and greens bowl, where half a cup of cooked black beans is mixed with lightly sautéed Swiss chard. The dish is gentle on digestion and provides steady magnesium without too much volume. People should be aware of safety points too, because too much magnesium can lead to diarrhea and dehydration, which is dangerous for anyone with stage 3 or above. Kidney disease supplements are especially risky because they can flood the bloodstream quickly and increase the workload of the kidneys. Magnesium can also interact with some medications like certain stomach acid reducers or water pills, so people must speak with a medical professional before adding supplements. As we move toward the next part of this discussion, it becomes important to highlight another mineral that plays a core role in enzyme activity for toxin filtering. This mineral supports tissue repair, immune balance, and antioxidant reactions that protect the kidneys from further stress. That mineral is zinc. Before we continue, tell me where you are watching from and what symptoms you are dealing with as your kidney disease reaches stage 3 or above. If you are trying to lower creatinine and reduce toxin load naturally, subscribe to Kidnease and turn on the notification bell because we only talk about stage 3 and above. If this helps you, type 1 in the comments or 0 if it does not, so I can keep improving for you. Zinc plays a major role in how your kidneys manage creatinine because the body uses this mineral to run antioxidant enzymes that protect your nephron cells from constant chemical pressure. Every time your kidneys filter waste, they face a wave of unstable particles that can damage tissue if the body does not have enough antioxidant support, and zinc is one of the minerals that keeps this protection active. Research from a major United States medical university has shown that low zinc levels increase kidney oxidative stress, which means the kidney is pushed into a higher oxidative load. Oxidative load simply means the body has more harmful oxygen-based particles than it can safely control. When those particles accumulate, the filtration units in the kidneys begin to work harder than they should, and this can elevate creatinine. Good zinc levels help the kidneys maintain tissue repair processes inside the tiny tubules where filtration happens. And this constant repair reduces inflammation signals that often rise in people with stage 3 and above kidney disease. The reason zinc supports creatinine control so strongly is because it helps build the structure of superoxide dismutase, which is an enzyme that neutralizes some of the most damaging waste molecules. When this enzyme is supported, the kidney faces less irritation and your filtration rate stays steadier. Kidney tissue depends on stable zinc levels to form protective membranes in the nephron walls. And that stability helps reduce the stress response that usually triggers more creatinine. Food sources that are widely used in the United States offer steady amounts of zinc, and they are easy to work into meals without increasing sodium or phosphorus beans. And lentils are one of the richest plant-based options. One cooked cup of lentils can provide around 2 to 3 milligrams of zinc, while one cooked cup of beans can provide around 1 to 2 milligrams, depending on the type. These foods also supply fiber that helps the gut control nitrogen waste before it reaches the kidneys, and this lowers filtration pressure. Cashews provide about 1.5 milligrams of zinc per ounce, and they offer healthy fats that support cell membranes. But anyone with kidney issues should pick unsalted versions, because flavored coatings often contain high phosphorus additives that add strain to kidney function. Fortified breakfast cereals often contain high amounts of zinc per serving, and the label will usually list zinc content in milligrams per serving, which helps you match your intake with your dietary plan. Eggs also offer around 0.5 milligram of zinc per egg, and the zinc from eggs has high bioavailability, which means the body absorbs it more easily than from many plants. The protein in eggs also helps stabilize blood sugar, which indirectly reduces metabolic stress on the kidneys. The ideal intake for people with stage 3 and above kidney disease should sit within a safe range that avoids deficiency without pushing into excess. Most adults do well with an amount that stays within normal dietary levels from food, and too much can create new problems. Zinc is best taken with a meal that contains some protein because protein naturally improves mineral absorption and lowers stomach irritation. It is better to avoid combining zinc-rich foods with high phytate grains because phytates bind minerals tightly and the body may absorb less zinc. Better pairings include meals that contain gentle plant-based fats or soft-cooked vegetables that do not interfere with zinc transport. If someone needs citrus-free ways to support absorption, they can use meals that contain mild acidity from foods like tomatoes or berries, because mild acidity supports mineral uptake without triggering heartburn. Choosing the right products matters because many store versions contain additives that work against kidney goals. When choosing fortified cereals, focus on boxes with low sugar and no phosphorus containing preservatives. When buying nuts like cashews, look for simple ingredient lists that contain only the nut itself without added oils or caramelized coatings. Beans should be stored in airtight containers if they are dry, and cooked beans should be kept in the refrigerator to keep mineral content stable and prevent spoilage. Nuts should also be stored in cool spaces so their natural fats do not oxidize. One easy recipe is a zinc-rich breakfast scramble that uses eggs, a small amount of cooked lentils, and soft vegetables like zucchini or spinach. Cooking lentils separately and then blending them into the eggs gives a creamy texture and provides zinc while keeping sodium low. Another simple dish is a creamy cashew and lentil blend made by soaking unsalted cashews, blending them with cooked lentils, and adding warm water until it reaches a smooth consistency. This is gentle on digestion and adds zinc without strain from salt. There are important safety points because too much zinc can cause a copper imbalance. Copper imbalance means copper levels drop too low, and that can weaken immune function and affect nerve health. Zinc-fortified processed snacks should be avoided because many contain phosphorus-based additives that increase kidney load. Supplements containing zinc need caution for anyone taking certain antibiotics because zinc can bind to some medications in the stomach and reduce how much the body absorbs. This is why most people with stage 3 and above kidney disease should depend mainly on food-based zinc, unless supervised by a clinician. If this is helping you understand how to support your kidneys at stage 3 or above, take a moment to like the video. That tiny click tells the platform that this information matters and helps Kidnease reach more people who are struggling at the same stage. As we continue, get ready for a mineral that plays a key role in how the body moves fluids, balances pressure in blood vessels, and clears toxins more efficiently. This next part brings us into the world of calcium. Calcium plays a bigger part in creatinine control than most people realize, because this mineral helps manage sodium balance inside the body. And better sodium balance reduces fluid buildup that places constant pressure on the kidneys. When the kidneys handle less unnecessary fluid, the small filtering units called nephrons do not have to work as hard. And this lowers the daily strain that often pushes creatinine higher in people who already live with stage 3 and above kidney disease. Calcium also helps maintain steady blood pressure because it influences how blood vessel walls tighten and relax. When blood pressure stays within a safer range, the tiny vessels inside the kidneys stay protected, and this supports long-term filtration strength. Research from a well-known university in the United States has found that calcium can improve natural phosphate binding, which is important because high phosphate levels force the kidneys to work overtime. Phosphate binding simply means calcium attaches to phosphate in the digestive tract, so the body absorbs less phosphate into the bloodstream. This helps the kidneys handle less chemical load each day, which is crucial when filtration has already slowed down. There is also a strong connection between calcium and body pH, and pH balance plays a direct role in toxin movement through the kidneys. When pH stays in a healthier range, protein waste breaks down more efficiently, and creatinine movement becomes easier. Many people with kidney disease ask why their body sometimes feels heavier or more sluggish on certain days. And one often overlooked factor is how well calcium is supporting their fluid and pH balance. Some individuals even notice swelling becoming worse when calcium intake drops. Have you ever had days where your ankles swell more but you did not change your salt intake? This can happen when mineral balance shifts inside the body. Foods that support calcium levels without increasing kidney strain are common in daily meals. Kale offers roughly 90 milligrams of calcium per cup when cooked, and it contains compounds that support gentle detoxification without overloading potassium. Broccoli provides around 40 to 50 milligrams of calcium per cooked cup and remains a smart option for people who need lower potassium choices. Broccoli also contains plant fiber that slows down blood sugar spikes, and better blood sugar control protects kidney vessels from long-term damage. Fortified plant milks provide a reliable source of calcium, and labels usually show whether they contain calcium carbonate or calcium citrate. Calcium carbonate is common and works well with meals, while calcium citrate is absorbed more easily by some people with sensitive digestion. Calcium intake for stage 3 and above kidney disease needs attention because too little can weaken bones and increase phosphate levels. Yet too much can raise the risk of stones. Healthy intake usually comes from balanced meals spread throughout the day rather than one large portion at once. Eating calcium foods throughout separate meals keeps blood levels steady and reduces the chance of overloading the kidneys in a short window of time. People who have a history of kidney stones should avoid pairing calcium foods with high oxalate foods like beets or large portions of spinach because oxalates mix with calcium and may form stones, and this can create more kidney stress in the long term. Good pairings include foods with gentle plant fats or lightly cooked vegetables that keep digestion calm and support smooth mineral absorption. Choosing the right products helps prevent hidden additives from raising kidney strain. Fresh kale should look crisp with deep green leaves and no yellow spots, and frozen versions are fine as long as the package does not contain added salt. Broccoli should be firm with tight florets, and frozen broccoli should not contain seasoning packets or sodium additives often included in flavored mixes. Plant milks should be checked for added phosphates and thickening gums that can cause digestive issues for sensitive individuals. A good product will list calcium without long chemical names linked to phosphate preservatives. Storing greens in breathable bags and keeping plant milks refrigerated with a tight cap helps keep mineral content stable. One simple meal that supports calcium intake is a warm vegetable sauté made by heating kale or broccoli with a small amount of olive oil and adding garlic for flavor without salt. Cooking these vegetables until tender supports easier digestion and keeps the calcium content intact. Another easy recipe is a creamy non-dairy blender soup prepared by blending steamed broccoli with a small amount of fortified plant milk and seasoning it with herbs. This creates a gentle, low-sodium bowl that supplies calcium without heavy ingredients. Quick question in the middle of this section because it helps many viewers reflect on their symptoms. Do you find it harder to control your blood pressure or your swelling? Comment below which one challenges you more so others can compare their experiences and feel supported. There are safety points that matter for stage 3 and above kidney disease. Too much calcium can increase stone formation because excess calcium can bind with oxalates in the urine. Calcium supplements should not be taken unless a clinician specifically prescribes them, because supplements can deliver larger amounts than the kidneys can safely manage. Calcium also interacts with certain thyroid medications and iron supplements by reducing their absorption when taken at the same time. Many people take their pills together in the morning without checking these details, and this can weaken medicine effectiveness. It is better to separate these medications from calcium-containing foods by a safe time gap if a clinician recommends it. Now that calcium has been covered with depth and clarity, it is time to look at a helpful bonus method that supports toxin movement in a way many people never think about. This next part highlights a technique that helps shift fluid, stimulates gentle flow, and supports filtration strength through a daily practice called the lymphatic floor pumping habit. The lymphatic floor pumping habit works because it stimulates the movement of lymph, which is the fluid that carries cellular waste through channels that do not have their own pump. The lymphatic system depends heavily on gentle physical pressure and muscle movement, so when this technique is done correctly, it helps reduce the buildup of waste that often becomes heavier in people with stage 3 and above kidney disease. This shift lowers toxin concentration throughout the evening because the body moves stagnant fluid before bedtime instead of letting it accumulate overnight. Many physical therapy centers have observed that simple rhythmic pumping motions help improve venous return, which means blood travels back to the heart more efficiently and reduces pooling in the legs. When blood and lymph move with better rhythm, the kidneys receive a more stable supply of filtered fluid, and this supports overall filtration strength. Have you ever noticed swelling in your ankles at night, even when you watched your sodium intake? That often happens because lymph movement slows down, and this technique can help. To perform the lymphatic floor pumping habit, sit in a supportive chair or lie on your back with your knees slightly bent so your lower body stays relaxed. The goal is to create soft, repeated pumping motions that activate the legs and the deep core without straining the muscles. Start by lifting your heels while keeping your toes down, then press your heels down while lifting your toes. This simple motion encourages the calf muscles to contract and relax, which helps move lymph upward. After 10 to 12 heel and toe pumps, tighten your lower abdomen gently for a few seconds, then release so the pressure helps lymph shift through the pelvic region. Repeat the sequence 2 or 3 times and aim to practice this 1 to 2 hours before bed. This timing supports fluid movement while giving your body enough time to settle before sleeping. Common mistakes include doing the routine too late at night, which may keep fluid moving when the body should be winding down. Another mistake is overdoing the number of pumping rounds, which can cause fatigue in people who already deal with weakness from kidney disease. Some forget to hydrate earlier in the day, and this reduces the effectiveness of the technique because lymph flows more efficiently when the body is properly hydrated. Moving forward, it is time to wrap up the core points from all three minerals, and this final method so you have a clear and simple plan. You can follow with confidence. Magnesium supports filtration and toxin movement and works well when taken from leafy greens, nuts, and beans. Zinc repairs nephron tissue and lowers oxidative load that often rises in kidney strain. Calcium keeps blood pressure steadier and improves detoxification by supporting natural phosphate binding. The bonus technique helps shift fluids earlier in the evening so toxin concentration stays lower. If your kidney disease is stage 3 or above, apply these steps with consistency. If this video brought you clarity and helped you manage your kidney disease at stage 3 or above, do not leave without subscribing to Kidnease. If you feel the guidance spoke to your situation and gave you something useful, type relief in the comments.